I'd like to welcome you to this edition of the PRS Journal Club podcast with your hosts, Dr. Sammy, Sinno, Amanda Silva, and Raj Sawh-Martinez. Enjoy.
Hello, everybody, and welcome to the October edition of the PRS Journal Club podcast. I'm your host, Sammy Sinno, and joined by my co-resident ambassadors, Raj Sawh-Martinez and Amanda Silva. This month, we're very fortunate to have our special guest moderator, Dr. Devinder Singh, joining us. This article that we're going to look at is entitled Complete Platysma Transection and Neck Rejuvenation, a Critical Appraisal by Dr. Mario Pelle et al. The impetus for this study is the increased interest in rejuvenation of the neck. Specifically, it's been noted that in many patients, even at a younger age, that the neck can age independently and at certain times at an accelerated rate compared to the face. Additionally, there have been great challenges by many facial aesthetic surgeons in trying to achieve optimal long-term results, specifically in terms of recurrent platysma banding. This is a very honest study that looks at one author's experience over a several-year period. He aimed to look at patient satisfaction and also an objective assessment of the results in his neck procedures, specifically in terms of anterior laxity of the skin and platysma bands. Over a 4-year period, he looked at 150 consecutive neck lift patients and reviewed those patients' results primarily at 3 months and 1 year. While he noted overall very high patient satisfaction, saying that at a year 76% of the patients were satisfied, he noted that this was a decrease from the 3-month mark. Additionally, he noted that only 52% of the patients at this time had no excess anterior skin, and that only 55% were free of any recurrent bands. He also did note that some of the patients had various complaints in terms of induration of the neck and sensibility changes. The procedure that he performs in the spectrum of neck lift procedures is fairly aggressive. And that includes wide undermining and also complete transection of the platysma muscle. So he questions in the very well-written discussion whether we should be doing these aggressive procedures when, in actuality, at 1 year, we haven't quite mastered the results in terms of two of the major visual changes, that being excess skin and platysma banding. He talks about the potential physiology of the platysma bands and gives some common purported mechanisms. One, that the muscle may have been inadequately sectioned, but with a complete transection, this would probably not be the case. He also mentions that muscle regeneration or that intraneural or intramuscular communications between the cervical branches may have a role in causing recurrent band formation at that 1-year time point. Nevertheless, I think for myself as a resident and being interested in aesthetic surgery, it's really wonderful to see a paper like this by someone that is truly respected as an aesthetic facial surgeon, basically saying that his maximally invasive technique right now isn't, in his opinion, satisfying in terms of long-term results, and begs the question and challenges us to see if we can come up with other ways to solve this particular issue. So I guess I wanted to open up this discussion to everyone. Dr. Singh, what do you think of this article, and what do you think of this particular area of neck rejuvenation?
Thanks, Sammy. I agree with you that it's a great article to see because focusing in on contouring of the neck is a topic that we really need to concentrate on because we don't have great solutions for it. And what's really clever about this paper is their focus on the patient satisfaction. And I think that that's a really in vogue kind of thing to do, like patient-reported outcomes. We see orthopedic surgeons publishing a lot about patient-reported outcomes, or PROs, and I think this is a stride toward that in the plastic surgery literature, and for that, I really applaud the authors. On the other hand, as you mentioned, it's a very honest evaluation of their own results, and it's unfortunately disappointing. The authors acknowledge that 35% of their patients at 1 year have recurrence either of banding or laxity, and that's after super invasive surgery. And that is remarkable honesty, and it really begs the question, is there a better way? And in my mind, when I finished reading this article, I began to wonder, is this an opportunity for the non-invasive aesthetic procedures that we have, including some of the newer things like Kybella, which I don't have a big experience with, and or Botox for the platysmal banding. So Botox for the banding and Kybella for the fat, and is that combination or some version of that going to replace all types of platysmoplasty in the same way or vis-a-vis that injectables essentially replaced all of brow lifting? And I think this paper is sort of the first stride toward that. They don't acknowledge in the end that or recommend non-invasive approaches, but when you have a 35% recurrence rate at 1 year after a maximally invasive surgery, I conclude that maybe non-invasive is the way to go.
Okay. I agree. I think that if you look at the patient in Figure 2, for instance, I mean, I think we can all agree that there's no way that any minimally invasive procedure would be able to achieve a result like that. But I think the point is that you make is very true in that a lot of patients, even as a resident, I've seen patients that come in and they're bothered by a cord or a band in their neck, and they want that resolved. And if they see that a year after surgery, they're going to look at the surgery as having been a failure. I think the non-invasive injectables and then also some technologies also being developed in terms of nerve ablators that can stun one of the cervical branches that may innervate those medial platysma fibers. I think those technologies are going to maybe have a role in combination with either less aggressive surgery or minimally invasive surgery to give a majority of patients, maybe in their 40s and 50s, not like the patient in Figure 2, but maybe those with less severe signs of neck aging, some better alternatives.
Well, bringing that up, Sammy, that's another thing is there's not a lot of data on how these patients looked preoperatively. Maybe there are some patients that are at risk for having poorer outcomes because of how they looked preoperatively. That would be interesting to look at as well.
Well, Dr. Pusick obviously developed ResQ and then FaceQ. I did a study on facelift patients with the FaceQ, and it involves some elements of neck satisfaction as well. It's anybody that attempts, and even though their questionnaire was not a validated instrument, I think anybody that attempts to get an honest look at their patients, write that. First of all, ask the patients those questions and then actually have the guts to publish it should be absolutely commended, as you pointed out, Dr. Singh. But I think that is a great point, Amanda. You have to know where people started from, and I think that's why those instruments are so amazing, because they've literally spent years developing them and asking patients and analyzing the results and knowing which are the best questions to ask. But that's absolutely right, and I think would add more information to a similar study down the road.
Yeah, I agree with everything you guys are saying. I think that those are all dead on. And just as an aside, maybe over the follow-up study, and one of the things I would think of is maybe comparing this to some of the other current neck procedures that are not necessarily, as aggressive with the full transection, but just banding and using platysmal plication. And the other thing, and sort of comparing them head-to-head with these outcomes. Is their recurrence rate the same, worse? Because I know we do talk in different studies about higher rates of recurrence and how to manage those and things we can do. And the other thing here that I saw is that 50% or so of the patients had some liposuction of the neck. So I wonder if that had a differential influence or not, and that doesn't really seem to be borne out. But just curious if some of that will help. People talking about some tightening that occurs from that scar from the liposuction, if that would make it or not a difference. But I think I agree. I mean, I think it's really impressive to have sort of honest out there results. And they do note, though, however, importantly, that really none of their patients discussed, or all their patients rather, were very satisfied with the surgery. sort of the subset of groups that talk specifically about the neck that had some dissatisfaction or noticed some recurrence, but that still I think people are pretty happy overall with their results.
Yeah, that's true, Raj. I mean, this is an experienced plastic surgeon who has a high volume of facial aesthetic surgery, so he's got to be doing something right, and he's taking a hard look at his own practice. And but I agree with you that this would be a lot stronger if there was some version of a control group, even a historical control group in his own practice, where he said, look, for the first 12 years I did this, and then in 2001 I changed and I did this for the next 15 years, and now I'm comparing. Even if he did that, it would be better than what this is, which is a single surgeon, retrospectively reviewed series, which he calls consecutive and prospective, but actually it's just a retrospective case series review, without any kind of control. So, Raj, you're right. Any kind of control here would really greatly improve this paper or any future paper for us to draw scientific conclusions. And of course, it's one surgeon, so it's very hard to generalize. And the very basis or hypothesis of the paper could be objected to by many facial aesthetic surgeons. For example, cutting the platysma bands is not uniformly agreed upon. Many people believe that the platysma should be returned to the midline, where it anatomically originated. And in fact, that's what I do in my practice. I'll make a small submental counter incision. I open the neck and basically do a standard corset platysmoplasty, just like Joel Feldman talks about. So from my perspective, I don't even necessarily agree with the whole idea of cutting the platysmal bands. I like to restore them back to the midline. I'll open that I'll open the chin. I'll run an epibond down to the hyoid and then run it right back up. And I feel like I get pretty decent results doing that. But then again, I've never published a paper on it, so I have to applaud the authors for taking the time to review their own data. One final comment about this paper is actually the bibliography or the references. They have cited some tremendous papers, which if I was a resident listening to this podcast, I would pull this paper if for no other reason than the references, including a review by Dr. Stuzin and several of the papers by Joel Feldman to talk about corset platysmoplasty. It's a really, really well-referenced paper.
Agree. Please check out those references, and then also we've paired articles with this particular paper that are also available online. Thank you, Dr. Singh. That was a great discussion.
My pleasure.
Thank you.